Regarding orders, something helpful to do can be to create a quick order. A quick order is something that appears where you can automatically select it with default settings in order to speed up your ordering process. So this is really useful for things that we do commonly, such as daily labs or maybe very frequent medications. So to do that, we select inpatient medications, try to find one that's available. So we have IV furosemide. We see a lot of heart failure patients at the VA. This is a very commonly ordered medication. For some reason, our patient has allergic reactions to pretty much any medication. So we'll enter a reason why we want to continue and continue with this ordering. So let's say we really like 40 milligrams because we have a lot of pretty responsive heart failure patients. I want to order this as BID diuretics. Again, unfortunately, it's not telling us our administration time, but we discussed this already. So we'll say this is for accumulation of fluid. And we'll skip comments for now and say priority is routine. So now we have our order set up how we like it. And rather than saying accept or quit, we're going to go up to options and say save as quick order. Now this is going to pull up the quick order, and you can see I personally have created a number of my own quick orders already. So we want to give it a name that makes sense, that makes it easy to recognize. So we'll say furosemide 40 milligrams IV BID diuretics, and we'll say okay. This is showing this going to put it at the top of my list, which is fine. Now we've said okay. So we'll quit this so we can demonstrate. We'll say no. Now when we go back into inpatient medications, unfortunately, we can't see it on this test patient because the patient is not inpatient. It says no quick orders available, but this IV furosemide dose would be in this area. It would appear and you would select it and it would come up with all of those same settings that we just selected. Furosemide 40 milligrams IV, BID diuretics for accumulation of fluid, etc. And so then all you have to do is select accept and it goes in automatically, or it can just simplify. Instead of you having to type in furosemide here, you just click on it here and you can then change the dose if you need to, etc. That's quick orders. You can also create them for labs. We haven't reviewed the lab test menu, but we'll add that on at the end of labs. You can also do that for radiology if you want to have a portable chest x-ray as a quick order so you can get them done quickly. Again, always make sure you're putting in the appropriate clinical information relevant to your patient when you place those orders, but it can save you time to be able to order those things rapidly.